a golden retriever chewing its own paws raw at 2 in the morning. Weeks of scratching, thinning fur, skin red and hot to the touch. Then the vet bill lands. $80 for the exam, $300 for allergy testing, and a prescription that runs $70 a month for life. But the same relief can start with something already in the pantry. A cup of plain oatmeal, about $1 worth, backed by recognized science that has been soothing irritated skin for centuries. So how did a breakfast cereal become one of the most effective tools against dog itching? To understand the answer, you first have to understand the problem inside veterinary clinics across the country. The problem is enormous. Canine atopic dermatitis is the clinical name for allergic skin disease in dogs, and it's one of the most common conditions veterinarians treat. Estimates vary depending on who you ask. Cornell University's Veterinary College puts the number at 10 to 15% of the entire dog population. Other research published in peer-reviewed journals pushes that figure even higher, with some studies suggesting up to 30% of dogs may be affected at some point in their lives. That means if you're walking through a dog park with 20 dogs running around, somewhere between 2 and 6 of them are dealing with skin issues right now. Scratching at their ears, licking their paws until the fur turns brown from saliva staining, scooting across the carpet, trying to relieve an itch they can't reach. And certain dog breeds get hit harder than others. Golden retrievers, Labrador retrievers, German shepherds, bulldogs, West Highland white terriers, and boxers all carry a genetic predisposition toward atopic dermatitis. If you own one of these breeds, the odds of dealing with chronic skin issues are significantly higher. The condition typically shows up between 6 months and 3 years of age. It often starts as a seasonal nuisance, flaring up in spring when pollen counts climb, or in late summer when ragweed fills the air. But for many dogs, what begins as a seasonal itch gradually becomes a year-round ordeal. The immune system, once sensitized, starts overreacting to dust mites, mold spores, and even the dander from other animals in the household. What starts as an occasional scratch beside a blooming garden can turn into a nightly ritual of chewing and gnawing that keeps the whole family awake. And here is what makes it particularly frustrating for dog owners. There is no cure. None. Not from the most expensive veterinary dermatologist in the country, and not from any pill or injection currently on the market. Every treatment available is managing symptoms, not eliminating the underlying disease. That distinction matters enormously because it means once you start down the treatment road, you are likely staying on it for the rest of your dog's life. So what does that treatment road actually cost? The answer might surprise you, and not in a good way. For decades, the go-to prescription for itchy dogs was prednisone. It is a corticosteroid, a synthetic version of cortisol, and it works by suppressing the immune system's inflammatory response. Prednisone is cheap. A month's supply might run $10 to $20, and it works fast, often within hours. But prednisone comes with a long list of side effects that get worse the longer a dog takes it. Increased thirst and urination are almost guaranteed. Many dogs develop ravenous appetites and gain weight rapidly. Panting, restlessness, and behavioral changes, including aggression, have been documented in studies showing that up to 30% of dogs on corticosteroids experience some form of behavioral shift. The truly concerning risks come with long-term steroid use. Extended prednisone therapy can cause muscle weakness, thinning skin, hair loss, increased susceptibility to infections, and a condition called iatrogenic Cushing's disease, where the body's cortisol regulation essentially breaks down. Veterinarians use the word iatrogenic because it means the disease was caused by the treatment itself. The medication that was supposed to help the dog's skin created a new medical problem. So the veterinary industry developed newer, more targeted alternatives. The two biggest names in modern allergy treatment for dogs are Apoquel and Cytopoint. But are they worth the price tag? Oatmeal is an oral tablet that blocks specific enzymes involved in the itch and inflammation cycle. It works within hours, and many dog owners describe it as life-changing for their pets. But Apoquel costs between $60 and $90 a month, which translates to between $700 and $1,200 a year. And that is just the medication, before you factor in the vet visits required to monitor the dog's blood work. Cytopoint takes a different approach. It is an injectable monoclonal antibody that targets a specific protein responsible for sending itch signals to the brain. A single injection can provide relief for 4 to 8 weeks, and studies show it works for around 70 to 80% of dogs. The cost ranges from $50 for a small dog to $200 or more for a large breed, with most dogs needing 6 to 8 injections per year. That puts the annual cost between $300 and $1,600, again before exam fees. Cytopoint can be an effective option for many dogs. Neither drug cures the underlying allergy, and both require ongoing veterinary supervision with regular blood work. They manage symptoms, often very well, but they represent a financial commitment that extends across the entire lifespan of the dog. For a 10-year-old golden retriever who started Apoquel at age 2, the lifetime medication cost alone could easily exceed $10,000. For a family already stretching their budget, that number can feel impossible. The question that keeps nagging at the back of every dog owner's mind is whether there is anything they can try at home first, something cheap and safe, before signing up for a decade of monthly prescriptions. This is exactly where Oatmeal enters the picture, not as a replacement for veterinary care in serious cases, but as a tool that can reduce the frequency of flare-ups, provide immediate relief during mild episodes, and potentially reduce how often a dog needs those expensive interventions. But does it actually work, or is it just another internet remedy that sounds too good to be true? The use of oatmeal on irritated skin isn't new. It's ancient. Historical records show that oatmeal poultices were used in ancient Egypt, Greece, and Rome to treat skin conditions. The practice survived through the centuries in apothecary shops and folk medicine because it kept working, even if nobody understood the chemistry behind the oat kernel. The modern chapter of the oatmeal story began in 1945 when a commercially available colloidal oatmeal product was first developed to treat inflammatory skin conditions. Colloidal oatmeal is simply oat grain that has been ground into an extremely fine powder, so fine that it suspends in water rather than sinking to the bottom. That fine grinding is what unlocks the therapeutic properties hidden inside the oat kernel. In 2003, the United States Food and Drug Administration officially recognized colloidal oatmeal as a skin protectant in its over-the-counter drug products monograph. That designation means the Food and Drug Administration reviewed the clinical evidence and determined that colloidal oatmeal is both safe and effective for temporarily protecting and relieving minor skin irritation and itching. It is one of very few botanical ingredients to earn that classification. So the FDA gave oatmeal its stamp of approval. But what is actually happening at the molecular level when oatmeal touches irritated skin? This is where the story gets interesting, because oatmeal does more than one thing. It does 4 things at once. First, there are the avenanthramides. These are polyphenolic compounds found exclusively in oats, and they are potent anti-inflammatory agents. Research published in the Journal of Drugs and Dermatology has shown that avenanthramides inhibit activation of a protein complex called nuclear factor kappa B in skin cells. That protein complex is essentially the master switch for inflammation. When it activates, it triggers the release of cytokines, the chemical messengers that cause redness, swelling, and itching. Avenanthramides help keep that switch turned down. Second, oats contain high concentrations of starches and beta-glucan, a naturally occurring complex sugar. When ground oatmeal dissolves in water and contacts the skin, these compounds form a thin protective film. That film does 2 things simultaneously. It locks moisture into the skin, preventing transepidermal water loss that makes dry, irritated skin worse. It also creates a physical barrier between the skin and environmental irritants like pollen, dust, and chemical residues. Third, oats contain natural saponins, which are gentle cleansing agents. These compounds help remove allergens, debris, and bacteria from the skin surface without stripping away the natural oils the skin needs to stay healthy. Unlike many commercial shampoos that can worsen dry skin by removing too much of the skin's natural lipid barrier, the saponins in oatmeal clean without over-drying. And fourth, colloidal oatmeal helps restore the skin's natural pH balance. Healthy dog skin typically runs slightly acidic, around 6.5 on the pH scale. When the skin becomes irritated or infected, the pH often shifts, creating an environment where bacteria and yeast can thrive. Oatmeal acts as a natural buffer, nudging the skin back toward its optimal range. So much for the science. But does knowing all of this actually help your dog tonight? It does, because the practical application is surprisingly simple. And unlike prednisone, Apoquel, or Cytopoint, oatmeal has no documented side effects when used as a topical treatment. All four mechanisms, the anti-inflammatory action, the moisture barrier, the gentle cleansing, and the pH buffering, kick in during a single 10-minute soak. Now for the practical part, the step-by-step that any dog owner can follow tonight. You need exactly one ingredient, plain unflavored oatmeal. It can be instant, quick cooking, or old-fashioned rolled oats. Any variety works, as long as it has no added sugar, flavoring, or other ingredients. A canister of store-brand oats costs around $3 to $4 and contains enough for dozens of baths. Each bath uses roughly 1 cup of dry oats, putting the per bath cost at well under $1. If you are finding this useful, hit subscribe. We cover practical pet care like this every week, the kind of information that saves you money and keeps your dog comfortable. Step 1 is grinding the oats into a fine powder. A standard kitchen blender, food processor, or even a coffee grinder will do the job. Blend on the highest setting for about 30 to 60 seconds. The goal is a consistency that resembles flour, not sand. When you pick up a pinch and rub it between your fingers, it should feel silky, not gritty. To test whether the powder is fine enough, stir a tablespoon into a glass of warm water. If the water turns milky white and feels smooth, the oatmeal is ready. If you can still see individual particles floating or settling to the bottom, grind it longer and test again. That milkiness is not just cosmetic. It is your confirmation that the oat proteins are small enough to actually contact and coat the skin, rather than just sitting on top of the fur. Now comes the bath itself. Step 2 is preparing the bath. Fill a tub or basin with lukewarm water, not hot. Hot water can actually worsen skin irritation by stripping natural oils and increasing inflammation. The water should feel comfortably warm on your wrist, like a baby's bath temperature. For a medium-sized dog, sprinkle about 1 cup of the ground oatmeal into the running water and stir until it dissolves completely. Within seconds, the water should turn a soft, milky white. That milky color is your sign that the beta-glucan and starches are suspended and ready to go to work. Technique matters more than ingredients. Step 3 is the soak. Gently place or coax your dog into the tub. Using a cup or your hands, pour the milky oatmeal water over the dog's body, working it into the coat and down to the skin. Pay special attention to the areas where the itching is worst, which for most dogs means the belly, between the toes, the armpits, and behind the ears. Massage the solution gently into the skin for a minute or 2, then let the dog soak for 10 to 15 minutes. This soaking time is important. The avenanthramides and beta-glucan need contact time with the skin to do their work. If you can keep your dog relatively calm and still for those 10 minutes, the results will be significantly better than a quick rinse. Some owners bring treats or a lick mat to keep their dog occupied during the soak. That patience pays off. But the way you dry your dog afterward matters just as much as the bath itself. Step 4 is rinsing and drying. After the soak, rinse the dog with clean, lukewarm water to remove any oatmeal residue from the coat. Then towel dry gently. Do not rub vigorously, because that friction can irritate already sensitive skin. Avoid using a blow dryer, especially on a hot setting, because the heat will undo much of the moisturizing benefit the bath just provided. That covers the full body treatment. But what if the itching is only in 1 or 2 spots? There is an even simpler method for that. If your dog only has a single hot spot on the hip or irritated patches between the toes, a full bath may not be necessary. Instead, make an oatmeal paste by mixing the ground oatmeal powder with just enough warm water to create a thick, spreadable consistency. Apply the paste directly to the affected area, let it sit for 15 to 20 minutes, and then rinse it off gently. This targeted approach works well for spot treatment and is much easier to manage with dogs who dislike baths. For an extra boost of moisture, some dog owners add a tablespoon of coconut oil or a splash of high-fat milk to the bath water. These are optional, and the oatmeal works perfectly well on its own. But the added fats can help dogs whose skin is especially dry and flaky during winter months. Avoid anything with artificial fragrances or essential oils, because those can irritate sensitive skin further. How often you give your dog an oatmeal bath depends on the severity of the skin irritation. For a dog going through a mild seasonal flare-up, 1 or 2 oatmeal baths per week can provide significant relief. Dogs with more persistent allergies might benefit from 2 or 3 baths per week during active flare periods. Veterinary sources indicate that oatmeal baths are well tolerated even with frequent use, because unlike medicated shampoos, the oatmeal is not introducing harsh chemicals to the skin. And because it is a food-grade ingredient, there is no danger if your dog laps up some of the bath water during the soak. That said, there are a few things worth knowing before your first attempt. One small but important precaution. If your dog has never had an oatmeal bath before, do a patch test first. Mix a small amount of the oatmeal paste and apply it to a bare area of skin, like the inner thigh or the belly. Wait about 24 hours and check for any redness, swelling, or irritation. Oat allergies are rare in dogs, but they do exist, and a quick patch test rules that out. So far, everything about oatmeal baths sounds almost too good. Cheap, natural, FDA recognized, easy to make at home. But what can they actually not do? Because that part of the story matters just as much. And pretending oatmeal is a miracle cure would be doing your dog a disservice. Oatmeal baths treat the symptoms of skin irritation. They soothe the inflammation, lock in moisture, and create a temporary protective barrier. They can reduce scratching, calm red skin, and give a miserable dog a few days of genuine comfort. For mild to moderate seasonal allergies, dry winter skin, minor hot spots, and general itchiness, they can be the only intervention you need. But they do not address the root cause of the allergy itself. If your dog is reacting to dust mites buried in your carpeting or specific proteins in their kibble, an oatmeal bath will ease the symptoms without eliminating the trigger. For dogs with severe atopic dermatitis, chronic ear infections, open sores, or signs of bacterial or yeast infection like foul smell, discharge, or rapidly spreading hair loss, veterinary attention is not optional. Those situations require diagnosis and treatment that goes beyond what any home remedy can provide. The smart way to think about oatmeal baths is as one tool in a larger toolkit. A veterinarian might still recommend Apoquel or Cytopoint for dogs with severe allergies, and the oatmeal bath can reduce the severity of flare-ups between doses. Some owners find that regular oatmeal baths allow them to extend the interval between Cytopoint injections from 4 weeks to 6 weeks, or even 8 weeks, which cuts the annual medication cost significantly. But here is what that actually looks like in practice. Some owners use oatmeal baths as a first line of defense, trying the home remedy before escalating to prescription medications. For many dogs with mild seasonal allergies, this approach works well enough that the prescription never becomes necessary at all. That is not a guarantee, and every dog is different, but it is a possibility worth exploring before committing to a $1,000 annual medication bill. There is something worth sitting with as you look at that canister of oats in your pantry. The most effective solution for a very common problem has been hiding in plain sight for centuries. Oats are cheap, gentle, and backed by more clinical research than many of the products lining the shelves at pet stores. The fact that a $1 oatmeal bath can provide the same immediate symptom relief as treatments costing $50 to $200 per dose does not mean those treatments are worthless. It means that for a lot of dogs, the expensive option might not be the first option that should be tried. Every dog deserves to sleep through the night without gnawing at their own skin. And every dog owner deserves to know that the tools to help are not always locked behind a prescription pad. Sometimes they are in the kitchen cabinet right next to the coffee grinder, waiting.